Dr. Quinn, thanks as always for being with us.
Hey, thank you for having me.
I understand you just got your booster. What kind of side effects can people expect?
I did. I actually have my card right here, and I'm going to put it away for safekeeping. But I had a very good experience, as I did with my first two injections. I did have a little bit of local, I'd say a little pain at the injection site, maybe just a little bit of fatigue early on today. But other than that, I felt really well. And overall, this has been the response that the majority of people have reported that have received a third vaccination. So overall, the CDC and all the other governing organizations are declaring that the third vaccine is looking like it's going to be very safe for the majority of those that take it.
Dr. Quinn, if somebody gets this third booster, the third shot, is it essential that well, first of all, is it essentially just the same shot they got before? And then another question, should it be the same brand as they got before?
Right now, what's being recommended is you do get the same brand. Now, as far as the booster, now this is different than the third shot. The third shot was for those that were determined to be so immunocompromised because of comorbidities, say they have cancer and they're on immunomodulating therapy, or maybe they've had some condition where they take high dose steroids. This group that was getting the third shot, it was determined that their immune system may not be strong enough to mount a robust enough response. So they were getting a third shot recommended about 4 weeks after the vaccination, and it was recommended that they get the same vaccination, the same brand. Now, for the booster, which is different, this is being recommended for those that are 65 and older, those that have medical conditions, and or those that work in occupations with high exposure, such as the medical field, myself, where we're exposed to people with coronavirus, even people that work in education, such as teachers with massive exposures to so many people. Now, in this scenario, the only one that's been approved so far is Pfizer, and it's recommended that if you've had the Pfizer and 6 months have gone by, you can get your booster Pfizer if you fall into that category.
Well, we realize that boosters are available to only certain people. Any word on when or if the general population will be eligible?
Well, right now, they're studying Moderna. They're putting their information in. They're studying Johnson & Johnson, those that receive those vaccinations, and that information should be available very soon. Now, note that when they were coming up with the decision as far as the advisory committee for the FDA, they decided not just everybody right now. And if you remember, we talked about that right here on this programming, where they were looking at the benefits versus the risk. And at this time, they've not yet determined that these benefits outweigh the risk, meaning that for the general population, say somebody that's 20 years old, they had both of their vaccinations, it's still being determined that they have pretty good protection as far as if they contract coronavirus, where they have a very low chance of getting severely ill and or getting admitted to the hospital or losing their life. And then they're still studying that myocarditis, that inflammation of the heart associated with the vaccination in that young population, especially males. So all of this is yet to be determined. But as for now, it's 65 years or older, those with chronic medical conditions, and those that have occupations that expose them to have a higher risk, because in that scenario, it was determined that the benefits outweigh the risk. So we just have to continue to follow the data and just put science first and understand that this is a very, very evolving situation.
All right, Dr. Timothy Quinn, when we have questions, you have answers. Thank you for joining us again today.
Appreciate it.
Hey, thank you.